If you're a medical doctor, if you have a medical foreign degree, if you're interested in practicing medicine in Germany, and lastly, if you're wondering what the compulsory FACHSPRACHPRÜFUNG or FSP exam is all about, then this video is for you. Hey warriors, how are you doing? I feel so happy to be back on here. It's been a while. I have been struggling with managing my time and also being on here. But with my new structure, I hope you would see more of me. If you're seeing me for the first time, welcome to the Tribe of Light. My name is Lucinda, a resident in internal medicine right here in Germany. As usual, let's dive into today's topic. I'll be talking about my experience. I'll go back in time and tell you step by step the procedure of the exam, just so you have a structure and an idea of what the FSP is all about. My exam was scheduled for 3 p.m. My goodness, I feel very emotional recalling that day. And I got there quite early. I got there at I think at about 1 p.m., like 2 hours before the time. I was there and I sat myself in the corner and I just prepared myself mentally, physically, and spiritually. I remember sitting there and just saying, Lord, you know what would be really cool? If I got a patient with chest pain and if my case was on myocardial infarction. But the exam is structured into 3 parts. The first part is where the patient-doctor conversation takes place. The second part is the documentation room. And the third room is the doctor-doctor conversation. So I start with the first room. I went into the room. There was my patient seated on a chair, and opposite her was a chair and a table for me. And then to the corner, to the right, was an examiner. He just observed us and I saw he took notes every now and then. My patient was a female. I introduced myself and then I sat down. I introduced myself as a doctor on call. This room, you're required to take a proper, detailed, structured anamnesis, just like you would do during your clinicals. The only difference is right now you have to do it in German. I know that can be challenging, but it's nothing you can't handle. I believe in you and I know you can do it. If I did it, you can. So I started with the patient's data, her surname, her first name, date of birth, age, and the sex. I noted all of this down. If you're unsure of the spelling, ask them to spell it, like M for something, U for this, and tell them to spell it, because you need to have like a correct data. It's very important, even in clinical practice, so you don't go making unnecessary mistakes and giving medications to other people and mixing up names and medications. That's why it's very important, and also for the exam purpose. So I went from taking patient data to the chief complaints. Why are you here? And she said she had like upper abdominal pain, which started suddenly like 2 hours ago after eating. What was it she ate? I can't remember. As soon as she opened her mouth and said her complaints, I knew it was something around like the acute cholecystitis or lithiasis region. From the chief complaints, I went on to the accompanying complaints. Does she have fever? Does she have vomiting? Is she nauseous? All these are very important. And if it's a pain anamnesis, you have to make sure you take the location, the duration, the character of the pain, what helps the pain, what worsens the pain, on the scale of 0 to 10, where is the pain. All these are very important. And then from the chief complaints, I went to accompanying complaints, and then I asked about her previous history. What medications does she take? Family history. You ask about the habits. Does she smoke? How many cigarettes does she smoke? How long has she been smoking, drinking? And the social anamnesis is also very important. What do they do for work? Do they have children? Are they living by themselves and all that? So like I said, it's basic anamnesis you do during your clinicals, just now it's in German. Halfway through the conversation, she tried to distract me. This lady, she says to me, oh, this morning I had, what was it? She talked about her neighbors. I'm just like, girl, in my mind, I'm like, I have 20 minutes. I have to get this done and dusted, and you have to give me all the answers I need. So if you find yourself in this situation, you're just going to nicely and politely redirect them to where you are. You both have to be on the same page. So I nicely told her, wow, that's interesting, but I would love to hear all about this at the end of our conversation. Right now, I would really love to concentrate on your complaints and see how I can help you. And then she says, okay, and then we moved on. So I noticed she didn't try to distract me anymore. So this happens frequently from other people's stories I've heard. They try to distract you just so the 20 minutes is up and then you're left with nothing. You haven't even asked why they are there, you know. So make sure by all means you get all your data, and then you can talk about whatever story they have or whatever distractions, then you can focus on it. In this room, the necessary or important thing to take note is communication. Your German will not be perfect, mostly if you've learned for just a short period of time. But make sure you understand everything she says and she also understands you. Be clear enough that she understands you. And you're also required to take the anamnesis in layman terms. Like, these people have no medical knowledge. So if she comes, you would ask about Bauchschmerzen, for example. That's like stomach pain. Rather than use abdominal pain, you would use stomach pain. You would use, in German, it's like Bauchschmerzen, abdominale Schmerzen, or Kopfschmerzen. You won't go there and say Cephalgin, which is a headache. So you get, like, you use the layman term in this room. 20 minutes looks like a long time. So each section, the exam is into 3 major parts, like I said, and each room is 20 minutes. 20 minutes looks like a long time, but I tell you, when you're pressed for time, 20 minutes is very short. Thank God I got all my questions. I already had like a structure, a systemic way of, I had rehearsed and practiced. So I got all the questions I needed, and then boom, the time was up and it was time to go to room B. I went to room B. I saw a guy come out and he went to room C. So I stepped into room B. There's no one in the room, just a chair and a table. On the table there was a small table clock and a phone. In this room, you're going to write out everything you've discussed with the patient. You're now going to document it in reported speech. Like, you're going to write clear sentences. A 56-year-old patient presented herself to the emergency room with right abdominal pain. The pain started at your detailed, but right now you would be using conjunctive 2 in German. Or is it conjunctive eins? What am I saying? But all these different conjunctive eins, you will learn them in basic German school. So it's very important. It's reported speech. I'll write it on the screen. It's reported speech. So you're going to write all of this down, and then you would also have like small boxes where they would write surname, first name, date of birth. So if you didn't carry out a proper anamnesis in the first room, here you won't be able to answer correctly. So that's why it's very important. You will see allergies, you will see the medications they take, you know. So that's why take your time in room 1. Make sure you answer and ask all the questions required and make sure you get a proper data, because in this room it's basically the data you have from the first room that will save you. Halfway through the documentation process, the phone on the table rings, and then I pick up and introduce myself. It was a lady calling from the lab. This happens every day, normal in hospital practice in Germany. It happens every day. You get calls from the lab. So for the exam purpose, it was a lady from the lab, and she was calling because a patient had like really high values of, I think it was creatinine or something. I can't really remember what case I had, but for example, creatinine, she says, oh, Mr. A has creatinine levels of, let's say, 10. He was born on so and so date and so on. It's also very important that you get the name correctly and you document everything the lady says on the phone correctly. This part, they just want to see if you're able to communicate with people you're not physically seeing. You know, if you can pick up a phone and talk and also understand what people say on the other side. Because in daily practice, you get calls from family members making inquiries about the patient. You will get calls from a different hospital. So this whole exam process is basic, the things you see every day in medical practice in Germany. It's just a simulation. Unfortunately, I didn't get the name of the patient correctly. I got the surname. No, I got the first name. I didn't get the surname. And I think I got every other thing except the surname. And I was trying to ask, and then the lady was already gone. So I'm like, we move. We move. So before I knew it, 20 minutes was also done. I don't think I finished. I think I was about writing like the last questions, because here you would also write like your diagnosis, the test you require and all that. I think I went all the way to a point. I almost finished, but I didn't finish completely. And then I went into the doctor conversation. This, to be honest, was the best part of the exam for me. I know this is where most people have like the most difficulty, but for me, to be honest, it was like the best. It was the best part. So I stepped into the room, I introduced myself. They asked me to sit down and to present the patient. But before presenting the patient, I told them I got a call from the lab and I would like to share with them what the lady said, you know. And I went from the name to the lab values and everything. And then the examiner says, there were two examiners in the room, and one of them says, what's the surname? At this point, I knew whatever I said. So I was like, to be honest, I got the name wrong. I know I got the name wrong. I tried to ask the lady from the lab, but she ended the call before I could say a word. So they were really nice and cool, and he corrected me and taught me how to spell it, and then I repeated the name after him, and we went into the examination. I presented my case. They asked for like the differentials, the tests, what will I see in an ultrasound, you know, what was my treatment plan and all that. So we discussed all of this. And then during the differentials, remember I had said, oh, if they ask me acute myocardial infarction, and then one of my differentials was myocardial infarction, and he's like, oh, tell me about it. What if it was a myocardial infarction? At this point, I'm just like, examiners in my head, I'm like, do not interrupt me. And I just went into myocardial infarction, you know. I knew this was like a chance to shine, and I just took the opportunity and I went like from the beginning to the end. And he kept saying, oh, you said you've never practiced. How do you know this? How do you know this? And I'm like, this is an exam. Am I not supposed to know it? But I didn't say that. I just smiled. And I think I said I read a lot. So yeah, the exam went really well. At this part of the exam, you're also required to, they would give you medical terms and you should say them in layman terms, or they say layman terms and you say them in medical terms. So for me, he just threw them at me. He just kept throwing them. Like, he would say Schlaganfall, I would say apoplex. He would say, so Schlaganfall and apoplex, it's like stroke. Schlaganfall is the layman term. Apoplex is like stroke. I remember he just Kopfschmerzen, Cephagin, we were just playing the game and it was just really relaxing. I saw them as my fellow humans. I didn't feel like I was in some kind of exam where I was scared of the human beings in front of me. Along the line, they asked what I would love to do. I told them internal medicine. They asked why. So all these questions were questions I had also practiced. I practiced really well. There was a WhatsApp group at the time where most people who had the exam, they come and say, oh, I had this patient today and these were the questions I got asked. So I saw almost every day people got asked what they would like to do, why did they choose Germany, where are they from? These are basic questions, and I made sure I rehearsed them in the best German I could find. So each time they asked, I was so grateful. I kept getting questions I was very, very comfortable with. At this part of the exam, most people also get questions on explaining procedures. For example, colonoscopy, a computer tomography, an MRI. These are possible procedures you can get asked. Basically, this is the exam. They just want to see your language proficiency, to see if you can communicate, if they can understand you, if you can understand them. I would say preparing for the FACHSPRACHPRÜFUNG exam doesn't start the day you get like an appointment. It starts way before that time. As soon as you know this is your goal, start studying and reading and practicing. Find study partners, find study groups. I remember I got like an appointment 1 week before the exam. Like, I think I got the email on a Tuesday for the next Tuesday. If I hadn't been studying, I would have failed. I'm positive I would have failed like woefully. Most people would say, oh, your medical knowledge is not really necessary. Just learn German. I would tell you, learn German. Also, medicine is important. Like, if I didn't know what myocardial infarction is, or I couldn't express myself, or you have to, yes, the language is important, but you also have to have medical knowledge of whatever you're talking about. So study both, study well, study both medicine, like you would write an exam in English, but in German, and also make sure your language is there. It won't be perfect, don't worry, it will never be perfect. Maybe it will be perfect, but I have given up on perfection. I just want to be able to communicate really well and to be understood. It's not my mother tongue, it's not my second or third language. So yeah, I would also say, as soon as you're done with your exam, it's not one of these exams you're done with and you leave it behind you. Make sure you save it up here, because you're going to need it every single day of medical practice. You will get patients when you're on call. You're going to take the anamnesis. You will document the anamnesis. The next morning, you would have to present the case to everyone at the morning meetings. The exam is basically your everyday life as a medical doctor in Germany, and all around, I guess. I will also say, maintain eye contact. Make sure you look them in the eyes. It's not arrogance. Be confident. Draw a thick line between confidence and arrogance and stay on the confident side. They can feel the vibe. If you throw off, oh, I don't know what I'm saying, even when whatever you're saying is correct, they can sense it. So be confident. Try to avoid monosyllabic responses. If you get questions that you are very comfortable with, make sure you take them, flap your wings and fly with them. It's a language exam, it's also a medical exam. They want to see how well you can communicate. I would also say be punctual. This is very necessary. I forgot to mention this. As soon as I stepped into the room for the doctor-doctor conversation, one of the doctors said, "You came really early. I noticed you were sitting around the corner during our lunch break." And I was shocked he noticed or remembered me, but this was around 3 p.m. and he could remember that he saw me like 2 hours ago. So be punctual. Also dress responsibly. Dress like you would want to be addressed, dress nice, look presentable. I did my exam in Dusseldorf and I'm so grateful till this day. Like, I really feel exceptionally grateful for how the exam went. I was more than blessed. I won't call it luck. That wasn't luck at all. Getting those questions I was familiar with, and I went home that day and I remember just lying on the floor and saying, "Lord, thank you, we did it, you did it." I have attached in the description box below a link to a Google Doc file containing all the e-study materials and books I used in preparing for the FACHSPRACHPRÜFUNG exam. You can check that out and sieve through. I wish you all the best. I know you will do well. I have faith in you, and my joy will be to see you and to hear like your stories someday. If you've watched this video up until this point and you haven't subscribed, my darling, what are you waiting for? Did you know that subscribing is free? And when you subscribe, when you like, when you share, you motivate me to come on here and create useful content that I know that people are watching for sure. And to all 431 of you who have not just watched the videos but also subscribed, thank you, and I have you in my prayers. I'm not joking. Sometimes when I pray for all the subscribers on this channel. So do well to subscribe, like, share, and I will see you in the next video.